Welcome into the Wednesday edition of Helping Seniors of Brevard. John Harper with you, along with, I was going to say Joe Steckler, Kerry, but Kerry Fink is with us. Joe Steckler is still recovering from his knee surgery, and we certainly wish him well as he continues to be on the mend, Kerry. And certainly you need today with the strong gusty wind to make sure you don't get blown around today.
Boy, I'm telling you, who would have thought, well, I guess this is 2020. We could expect anything, right? But, I mean, who would have thought here we are getting a week or so away from Thanksgiving, and we're still talking about hurricanes and tropical storms.
Well, you're right. And with the two latest hurricanes or tropical storms, I should say, that have now been named out in the Atlantic, this is a record-breaking season, 30 named storms.
Well, I think everything about 2020 has been record-breaking if you think about it.
Boy, hasn't it?
Let's see. We still have 2 months to go. So.
It has been absolutely crazy, but I want to tell you, it is something for the record books, and no matter what category it seems you look at. But nonetheless, we're always happy to be here on Wednesdays with Helping Seniors of Brevard. And again, Joe Steckler is on the mend, and hopefully he'll be behind the microphone here real soon. We're looking forward to that.
Absolutely. And I was going to say, I just wanted to point out, since we are, in fact, observing Veterans Day today. In fact, I saw Eric had brought in fudge for veterans here, which is seriously, I was reading up a little bit, and what they say is Veterans Day is a federal holiday in the United States, observed annually on November 11th for honoring military veterans, that is, persons who have served in the United States Armed Forces. And it coincides with other holidays, including Armistice Day and Remembrance Day, which are celebrated in other countries to mark the anniversary of the end of World War I, etc. And so, first of all, John Harper and Jim Votro, I want to say thank you guys for your service. And as we're talking about this, also, I guess many people know, but I'm not sure all know, that Joe is a retired Navy captain. When he's on the radio, he talks about running submarines and things like that. In his days, he was a captain of submarines and part of that whole force. And his last command, as you know, in the Navy he was in charge of the Naval Retirement Home in Mississippi, and I guess that's what has given him this passion for everything seniors. So as you know, when Joe and Terry retired here to the Space Coast of Florida, Joe just couldn't stay. Joe couldn't stay retired, so he gets involved and starts helping the Alzheimer's Foundation of Brevard build up its endowment, getting the Joe's Clubs established and all that. And then, as you know, when he retired from that, he couldn't stay retired, so he gets started with Helping Seniors of Brevard. And since 2011 now, we've been the county's senior information line, helping people with all sorts of issues along the way, John.
And just came off of the most successful annual fundraiser that the organization has ever had with our car raffle. And that proved to be a great event and a good fundraiser for the organization. Already looking forward to the new year. Of course, all of us are looking forward to the new year no matter what. I don't know if I said last week on the air, Jim Votro had sent me a cartoon with Kermit the Frog. This was when we went from daylight savings time to regular savings time, and Kermit was on the ground screaming, saying, "I don't want one more hour of 2020. I want to stay on daylight savings time." So
yeah, no, and the way you're saying it is right. And you're right. The 2020 Helping Seniors car raffle was by far the most successful to date in the Helping Seniors history. And while we're sort of laughing in sort of a dark humor kind of way about 2020, it is more important than ever for an organization like Helping Seniors to be serving, because here we are, they're still talking about COVID. We're going to have Dr. Lee Sheldon, by the way, as our guest today on the radio show, and we have a great show called The Advantage of the Patient Advocate. But before we bring him on, I just wanted to add this. We are in the thick of all this COVID-19 stuff, which has really defined the bulk of this year. And so the CDC has some good guidelines as we're getting ready to talk about Thanksgiving and the holiday season, Christmas, and everything, that all the stuff that comes together in these last months. They put together a pretty good checklist. We're going to make sure that we link it out on the Helping Seniors website, which is helpingseniors@brevard.org. But there's a lot of stuff goes on because, we're excited that we're close to a vaccine. We're excited that we're hearing that they're making progress in treating this. But it's also pretty clear that there's a lot of cases out there. And I guess the thing is we want to be careful and not get complacent in our efforts.
The CDC even gave guidelines to NASA on how the astronauts should proceed with their scheduled launch this coming Saturday night.
Wow.
Of astronauts right here from the Kennedy Space Center, historic launch pad 39A, and what they and their families had to do leading up to this week and the launch coming up on Saturday. You certainly don't want to have any type of virus breakout on the International Space Station.
Well, that would be a rough thing because, but they've always done that in the early days of the space program. They would always quarantine folks for a certain period of time. With that in mind, and I remember famously was Apollo 7 where they got head colds up there, and I think
Yes.
that really put everything into we gotta take real care. But I can only imagine it must be an overdrive as you're describing.
Yeah, it's got to be. But they've got the families involved as well. Everybody was in quarantine, so kind of amazing. You mentioned Joe Steckler being a submarine captain, commander. Can you imagine being on a submarine? Of course, they could always surface, but if they had to stay submerged, having an outbreak of the COVID breakout on a sub?
Wow, I cannot imagine. I remember one time, I think I'm quoting Joe correctly, but I might have it wrong, but I think he said his longest run underwater was 66 days. And can you imagine? That's like over 2 months. Could you imagine being in the little sardine can under the sea for 66 days? And you could either pop up and not even know what's a COVID, or worse yet, you run into something on board and now you're under orders or things like that. That's really complex when you think about it.
Yeah, it really is. But have you ever been on a sub?
Only touring them. They have several of these diesel electric submarines that are on display at various museums. So I don't know if that's really like a good example of them, but it's fascinating to walk through them. That's for sure.
Yeah, it really is, and especially the older subs like Joe Steckler commanded. Those were, I'm sure, even smaller than the subs today, and it took a very special type of man. I guess these days women are in subs as well, but it takes a very special person to be able to endure that.
Yeah, so we are, like we said, it's Veterans Day, so we're grateful to everybody who's kept us safe and free in the United States of America. And again, speaking of staying safe, like I said, we want to, as we're getting towards these holiday times, we want to really take a look at this. The CDC has a number of guidelines. They're talking about considerations for hosting or attending a gathering. So that's one of the things, if you remember, John Harper, we talked, I guess, a week or so back with Jennifer Helen, who was describing that she has somebody in her family, like an aunt or something, who's like 93 or something, and they're having to adjust everything to stay safe throughout the whole holiday situation. So that's why, thank God, we have FaceTime and we have things like that. But again, we're going to link to this from the Helping Seniors site, but there's really good information, considerations for hosting or attending a gala, food and drinks at small holiday gatherings. So I guess that's a whole area we want to think safety about. There's a section on travel and overnight stays and considerations if you're staying overnight or hosting overnight guests. So lots of good things, and even there's a like a checklist, steps to take if exposed to COVID-19 during a holiday gathering. So I think it's really good information, and again, seems like we got to just make sure that we stay vigilant and don't get complacent about it.
And this Friday on the Information Overload Hour at 12 noon, we're going to be talking more about a virtual Thanksgiving.
Yes.
As many people are exploring that idea, we're going to be talking about holiday cooking and everything else that goes with the upcoming Thanksgiving and Christmas holidays, New Year's as well. It's going to be a lot different this year than we have ever known in the past, Kerry, and should be interesting. Remember last week I said if you want to save on Christmas presents, just talk politics this Thanksgiving. And
Yeah, you'll clear the room, I'm sure. Everybody will take a side, and you don't have to worry about it. I'm not coming to see you anyway.
Yeah.
Well, it's the country we live in. But, I really think that the spirit of America is such that no matter how much we argue and we get into all these sides of things, we really do come together about the things that matter. And I really do believe that as we've been creative through everything, when they threw us COVID, starting with 30 days to stop the spread, and here we are months later, I really do think we're going to find a way to enjoy this holiday season in a special way because, quite frankly, I think hopefully a positive side of COVID is it's caused us all a lot of reasons to think through things and to maybe not sweat so much the small stuff.
Well, virtual Thanksgivings or whatever type of Thanksgiving people have planned or will be planning for this year, one thing for sure is we probably won't lose any weight.
No, we'll be finding good turkey, good things to eat. That we can do safely at home.
That's right. Yeah.
So we're going to have Dr. Lee Sheldon. Do we have him available?
We have him available, and we were before we get to Lee Sheldon, we were talking about submarines. Wouldn't it be terrible to be on a submarine and have some type of a dental disease come to play in that submarine, whether it be a toothache, a abscess tooth, whatever it may be? That would be a fine how do you do, wouldn't it?
Yeah, I think so. And I think I've heard Joe tell the story of him going through something on a submarine once, and that was more complicated than it, and probably a whole lot less fun than he was even describing it to be.
I don't know. We need to ask Joe. Maybe Jim Valtro, you know this, but do they have doctors and dentists on board the submarines?
Yes, they do. They
really?
do now. I don't know if they did back in the dark ages when Joe was riding the turtle, but honestly, I do know that now they have a full medical lab on board. Corpsmen, they've got dental technicians, and they've got doctors, and anyway, a doctor can generally handle a lot of the dental things if they paid attention in class. So
that's right. And you know too, as we've learned here in COVID world, that telehealth works, and so I'm sure that now. They've got, even if they don't have something directly on the ship, they can pick up and call somebody and say, what do we do about this? Although I guess if you have an abscess tooth, it's probably not so much you can do till you get to somebody.
That'd be rough if you have to be underwater for 60 days on a maneuver, right?
Yeah, this is true.
Wow. But we've got Dr. Lee Sheldon on the phone with us.
Hello.
Can you hear me?
Hello, Dr. Sheldon. How are you, sir?
I'm all right. How are you, Kerry? Hi, John.
Good. We've been celebrating Veterans Day and honoring those who have served, and then we have been talking about the CDC guidelines that hopefully lead us through a safe Thanksgiving, Christmas, Hanukkah, holiday season, and everything going on as we reach into that. I guess the story is we've made it safely this far. Let's not blow it as we get close to the vaccine and the treatments and all those kind of things.
Man, oh man, I heard you talking. I wanted to talk, and nobody, I couldn't talk. I had something, particularly with what Jim Vato just said. Jim, do you really believe that in medical school they learn anything about dentistry?
Well, I know I'd go to the doctor a lot. I know that they can't do a whole lot. They can give me pain medication and they can give me things to to mitigate the abscess or whatever. When I go to the dentist, I just know I hurt. I'm one of those kids that I grew up with going to I had braces for 4 years, and then I went to the dentist for a whole year. They filled every tooth in my head. They did that terrible old thing where they hollowed out the whole tooth. They didn't do the little pin things. And that's why so many seniors right now are having real fits with their teeth just crumbling. And, they don't know what to do. You go to Medicare, well, they'll pay for some preventive care on some policies if you've got an Advantage plan. One of the things a lot of people are looking at right now is they're looking for Medicare with much more dental that covers extractions, and dental that covers things like dentures. I mean, it's really, I think it's a real serious thing. I mean, I know it's expensive, but I mean, we paid into that Medicare stuff for so long. They need to get dental care too.
Well, first of all, you changed the subject entirely, which is very good. I mean, you're a radio guy.
Of course. What do you think? I'm a Democrat?
If I ask you a question, if you can't answer it, you come up with another subject. I think you ought to be a politician. But the original question is: do you think in medical school they learn anything about dentistry? And do you know what the answer is? Nothing.
They
Nothing
do.
At all.
What about people? People have heart problems because of dental work.
Are relegated to dentists, and if you talk to a physician, any physician, and you ask the physician, what did you learn about dentistry in medical school? And it wasn't either whether they had to pay attention or not. They never learned a thing.
Well, they do have to.
If you're on a submarine, by the way, they do have dentists on submarines.
I know they
now,
do.
But they have to be big enough.
Yeah.
They certainly have dentists on aircraft carriers. And if you get into trouble, you're right. A physician, about what the physician can do right now, which is better, it's certainly good enough, is what you talked about. They can prescribe antibiotics, that's about it, and do pain medication until you get into port. And if you're there for 66 days, and by the way, the son of my office manager was in the Gulf for 79 days.
Wow.
Yeah. And by the way, it was during COVID season, and what was very interesting about that was that during COVID season, so this was in March, they had, you're in an isolated petri dish. I mean, this is a great place to culture any bacteria, any virus, anything. And interestingly enough, only 20% of the people, or fewer than 20% of the people on the aircraft carrier actually got COVID. And here they are; they're right next to each other, they're bunking together. But it was only 20%, which was the first inkling that we had that younger people aren't as prone to getting this disease, or if they are getting the disease, at that point there wasn't a lot of testing. If they're getting the disease, that in fact it wasn't going to be lethal to those people. I think there was one person who died as a result of COVID on this contained on this contained vessel. Wow. So that was the good news, and that of course was March. Now we fast forward now to November, where we know a heck of a lot more about this disease. Mm-hmm. And yes, it's encouraging that a vaccine may possibly be available. I just did some coursework on vaccines that are coming out, so I have some knowledge there, not a lot, but a little bit. But yeah, it is very encouraging that in fact there is a way to kill this virus and to gather herd immunity, which according to at least this course, herd immunity is considered to be present when something between 50 to 60% of the people have had the disease or have a vaccination. Yeah. And one concern is to get the vaccination early, because if you allow this disease to continue to proliferate, then you'll get different forms of the diseases. And now, just like the flu, where they're trying to predict each year which flu you're going to get, because the flu has been allowed to mutate so many times. If you get the vaccine early, you'll have fewer mutations and therefore a better chance to confer herd immunity quickly. So I think it'll be full speed ahead with this vaccine. There will be a number of different vaccines available, which will all attack the disease in a slightly different way. And I think there's going to be more to be learned about this. First thing they're looking for is safety. And once they have safety, then it's going to be, all right, vaccine number 1, vaccine number 2, vaccine number 3, who gets what, how often do they get it, who's going to get it first. I mean, there's going to be an awful lot of steps that they'll put in place as far as the protocols go, and then they'll have to refine the protocols as they learn more and as more different vaccines come out.
Of course, Lee Sheldon, there's a 90% chance that the particular vaccine that has been tested so far will be effective. But we want to talk more about that and some other things associated with that. And, of course, dentistry. That's what Lee Sheldon is here with us for this afternoon on this Veterans Day as we celebrate it right here on 90.3 FM, helping seniors of Brevard. And a little bit of a tribute to Veterans Day right now. And God Bless America with Lee Greenwood, a song that Lee has really kind of come to be known for throughout the years. When I guess Kerry, Fink, this song came out about 20 years ago or maybe more, right?
Yeah. It's hard not to feel patriotic when you hear that song. It's really built up and has really become emblematic.
Here on 90.3 FM, helping seniors of Brevard. It's Wednesday, and we always have this program on the air. Kerry, Fink from 12 noon to 1 o'clock.
Thank you, John Harper, and it's a pleasure, as always, on behalf of Joe Steckler, our president, founder, and regular host of the Helping Seniors radio program, and also Kim Bernard, who's our education specialist. Let me get a couple of quick housekeeping things kind of nailed down. I want to give you the Helping Seniors information line, so if you grab a pencil and a paper, I'll give you that, and then we're going to get back with Dr. Lee Sheldon, who is an expert. He's a noted periodontist. He's the head of the Solid Bite Dental team here in Melbourne, Florida. Been with Joe since back in, I guess, the days. In fact, the story is just like you, John Harper, introduced Joe to radio. Dr. Sheldon introduced Joe to television on Dr. Sheldon's TV show.
That was in the early 90s.
That's right.
Yeah.
So before we get back into the show, though, let me share the Helping Seniors info line. It's 321-473-7770. It's 321-473-7770. People are always asking, what does Helping Seniors do in this area? So you already know that we do the television, the radio. We do a lot of things online. We have the newsletter that publishes each month in the center section of Senior Scene magazine. But the main service to our community is a little bit more off the scene than that. It is that we have operated since 2011 the Helping Seniors information line and helped literally thousands and thousands and thousands of families who call with all kinds of questions. It can be legal, it can be financial, it can be housing, transportation, it can be pharmaceutical. The list goes on. And Kim and Joe have tirelessly made sure that we've been able to help people along the way with that. And in great part, it's thanks to folks like Dr. Lee Sheldon, who has stood with Joe all these years. And in fact, I'm looking at our Senior Scene magazine, and in fact, this month's edition, the November edition, has a great article from Dr. Sheldon called "Why Shouldn't You Do Dental Implants?" which is an interesting topic, considering that Dr. Sheldon is probably the most reputable and leading resource in our area for that. But today, Dr. Sheldon, if you're with us, we're going to jump into this topic that which I think is a great topic, called the advantage of the patient advocate.
Yeah, let's talk about that. By the way, happy Veterans Day to everyone as well.
Absolutely.
From an Army veteran. So
thank you for your service, sir.
I'll tell you, it's probably, when I decided to go into the Army, I never knew how important it would be to me today that, in fact, that I served at that time, and I served as a dentist. So it's, I'm very proud when I've gone to events and people ask veterans to stand up and that type of thing. It does create quite an emotion. So anyway. It's a good day. It's a good day for everybody, and to all of you, thank you for your service, to the things you've done to help us be free and help us be the country that we are. So let's talk about the patient advocate. You know, it's something that's near and dear to my heart because a number of people come in here because they need major dental work, and for some reason the spouse decides not to attend. And I want the spouse to attend. I want the loved one to attend. I want them to be able to hear directly from me, because how much is the patient going to be able to translate to the loved one once he or she goes home? So it's important in dentistry. It's important in medicine. It's important when you're making a major decision that you have somebody to discuss that major decision with. And the best way of being able to discuss that major decision is for both of you to hear it from the doctors and from the staff's mouths at the same time, so you can ask the preliminary questions, and then you're both going home having that discussion with the same basis of knowledge. There are going to be more questions to be asked. There always are when it's a complex situation or where there's major decisions to be made. But at least you can get the information. You can then discuss it. You've probably only gotten the first 20% of the information, but then the two of you are discussing it together, and then you go back and call the doctor or call the staff member to get questions answered, so you can finally get to the 100%, so that so everybody's in line, everybody is getting the same piece of information, everybody can make the decision together.
That really seems so important, Dr. Sheldon, because, I'm thinking about not only like in the case of maybe spouses where they're talking about, well, this is a big thing that's going to impact one or the other. And, what typically happens, well, how did it go? Well, I got this report and I got to do this and I got to do this. And then, of course, the other one has a million questions. And so it really does seem like it makes great sense if everybody can be in the same place at the same time, ask all those questions together. And then it gets even more complicated, I'm sure, when we talk about the complexity of situations for seniors where maybe there's an adult child or somebody that's taking care of mom or dad or aunt or uncle, and they're bringing them in. And so they're having to help in that decision-making process at some level. And it really just seems like it's important to have somebody that not only can ask good questions, but also ask the right questions at the right time.
Yeah, it's true. You remind me of a patient I saw last week, and this woman was probably in her maybe 40s, maybe early 50s, and she had referred her husband over here, and he needed major dental work. And then she came and she wanted me to look at her 17-year-old son and her 20-year-old daughter. And so I was talking with her, and she said, I want you to know something. There's a reason I'm here. And she said, years ago, you saw my father. Now, my father was deteriorating mentally. He wasn't doing very well. And I was the caregiver. And you looked at him and did the examination, and you took me aside and you said to me, let him enjoy his life. In other words, don't get any dental care done. So 10, 15 years later, that's the reason she comes. There's a certain amount of selling that goes on in dentistry. Anybody who's gone to a dentist knows that there's a certain amount of presentation that you do in order to be able to impart enough information. And unfortunately, sometimes we're overselling things, or we think that it's really necessary, but maybe it might not be necessary for the individual. There is a treatment called no treatment, and I don't care whether it's in dentistry or in medicine, because in medicine we have the same problem. I want to do this diagnosis. I want to do this diagnosis. Let's rule this out. Let's rule that out. And the question is, all right, if we do rule it out, or if we don't rule it out, and I'm talking about in medicine, what difference is it going to make to my overall quality of life? It's a question that needs to be asked. And sometimes when you're in the middle of the disease and you're saying, I've got this, and it's got to be treated because the doctors say so, sometimes it takes another person who's level-headed enough to say, all right, I know there's a lot of emotional involvement in what you're in right now, but can you tell me what will happen based on the literature if we don't treat this?
Right.
Sometimes we don't give enough credit to no treatment as being the appropriate treatment for patients.
I was going to comment on the very article that you have published in the Helping Seniors newsletter in your copy of Senior Scene magazine, where the title is, Why Shouldn't You Do Dental, or Why Shouldn't You Do dental implants. And I know we've covered this topic on television. We've covered this in print. We've also, I think, talked about it on the radio. But it's such a almost odd juxtaposition coming from somebody who is probably like the area's leading expert in all this. But I guess it's probably a reaction to something that you said, like we get bombarded with TV commercials all the time saying, oh, it's so simple, just do this. And people don't really ever think deeper. And this is, again, maybe the area for the advantage of the patient advocate, too.
We do. I mean, we have the assumption, for example, the periodontal disease can't be treated. And so, again, another patient came into me, and she was already, or not, she was actually getting another opinion because she was told the only answer is to take out the teeth and put in dental implants. All right, and I take out teeth, and I don't do it anymore, but Michelle Furtado does, and my son does, and they do the work together, which is fantastic. And I'm here to examine the patient and to help the patient make decisions. But the patient comes over here with that recommendation, and I look at her and said, "You've got periodontal disease. We can treat it, and I'm sure we can keep your teeth for at least another 20 or 30 years, and probably longer than that."
Wow.
So it is important. There has to be that, and this is actually next month's show. We're talking about that right now. Maybe we ought to talk about next month's show this month, and we'll do today's show next month. But it is important. It is so important. You're right. We probably do more dental implants than anybody, and there's also a time to say no. It's not the right treatment. There are better treatments. There are more conservative treatments that it may make a lot more sense for you to save the tooth rather than extract the tooth. So it is the reason that people need to ask critical questions and not just assume that the doctor knows what you are considering and what's important in your life. And it doesn't mean you have to badger the doctor with questions. It goes. We did a program earlier this year on getting a second opinion. Mm-hmm. It all goes along with that. It has to fit. There's nothing that there should be nothing in dentistry and in medicine that can't be logically explained so you can make the decision rather than say the doctor knows best.
That's one of the things I was going to comment too, is that you always do a very, very extensive first visit. Somebody comes in, it's not just like, I'm sure they come in and say, I got a tooth hurting here. But from what I understand, you take a lot of time to really get like a whole look at the whole picture. And I assume that's probably also valuable not only to the patient, but the patient's, the people that are involved in the patient's care.
It's true. And if I didn't have a staff who could carry the ball for me, because the patient's here for 2 hours, but I'm seeing the patient for a half hour, sometimes 45 minutes. But then it's a staff member who's all of whom have experience and they understand what I've said because sometimes you have to ask the question 3 or 4 times, and so the staff member can do that. So yeah, it does give us a great opportunity. And imagine when you're in a session with that staff member and you have the loved one with you, so both are firing questions and getting the questions answered, and to do that and to get that done is it's important. I'm going to tell you, Kerry, for our dental implant cases, our major dental implant cases where we're doing the extraction and putting dental implants in, there's got to be at least 5 hours of staff time involved in helping the patient make the right decision.
Sure.
Because it is a critical decision. And we want to make sure that all bases are covered. Not everything is perfect. We're doing dental implants. We're doing a prosthetic substitute for your natural teeth. It's like having an artificial leg, and just like you have to learn how to walk all over again, you have to learn how to chew all over again. Don't get me wrong; dental implants are fantastic, but you've got to go through a certain process to understand what you're getting before you decide to get it.
And that's something that you said, in the article in this month's edition of Senior Scene. You're mentioning a periodontist has many more tools available to help you. So get a referral to a periodontist or visit one yourself. And I assume this is after you've been maybe someplace where they said, oh, just yank it out.
Yeah, there's a concern on my part that just because the patient could not be treated successfully in the general dentist's office, that in fact that's the end of the teeth, particularly with regard to periodontal disease. There's so much periodontal disease that can be treated and can be treated successfully before it is too late. And the only time it's too late is when the tooth is loose. If you have periodontal disease and advanced periodontal disease and the teeth are still tight, get over to a periodontist. Just get over to a periodontist. You don't need to be referred. Just go to a periodontist, because the assumptions that might be made in the general dentist's office that it can't be treated may be untrue, and that, in fact, the periodontist is very well equipped to be able to help you regrow some of the bone back that you've lost and get the teeth stable and keep your teeth for many, many years.
Well, isn't that another reason why having the advantage of that patient advocate is with you? Because, the problem for us is we don't really know. So we go into an office and the medical professional tells us, you need this, 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 this. And number one, we don't understand half of what they've explained to us. Number two, we don't know if that's accurate or not. Number three, we're probably a little bit intimidated and don't even know the right questions to begin to ask. But if you have somebody else there with you, whether it's there in the office or, like even you've suggested, maybe in today's COVID world, it could be via Zoom or whatever. But at least then, you're getting those right questions asked. And you've done a number of articles and TV shows over the year where you've talked about the value of second opinions and things like that. Yeah,
it's true. And Zoom does add to it. It's not the same as having the experience right here. But Zoom is important. I call every one of my patients before they come in for examinations. And there was one patient, and we're booked out for a month, and patient had a particular concern. She doesn't live here, and she was concerned about something, and she wanted to get the ball rolling with me, even though she's moving to South Florida or moving back to South Florida. I said, let's get on Zoom so I can look at your tooth and see what the consideration is. All right, pull your lip down. Let me take a look. And I said, you don't have to worry about that. Don't worry about it. You're moving to South Florida next month. Let me refer you to a good periodontist down there, but you're not going to lose the tooth. There's certain things you can tell just by looking at the patient through a webcam. So it's neat. Zoom is a great tool. It helps, and was able to reassure this patient that it can be done. But everything that we're doing now in the dental office is done digitally. So if I'm taking the CAT scan or doing X-rays or taking photographs or all the things we do, all the probing that we do, all of it is digital. So if the patient can't make it here, I can do a Zoom conference with. If the spouse can't be here or the loved one can't be here, we can do a Zoom conference together later on, and we've got all of the tools at our disposal right here, so that the loved one can be included, even if he or she can't show up at the visit.
Such important information to share, and it's the value of getting your circle of patient advocates together so that we're making the right decision, whether we're the one that's helping somebody or whether it's us ourselves. So, Dr. Sheldon, we're getting a little bit close toward the end of the show, but I wanted to talk a little bit just before we got out of here, because you really have helped Joe and the Helping Seniors organizations through the years with a program that you do that, number one, not only is of great benefit to a patient, but it's actually something that ends up being a fundraiser for the organization as well. And I didn't want us to expend our time today without at least talking about how that program works.
Yeah, it's we've now named it Solid Bite Smiles Back.
Uh-huh.
And so it's our charitable giving campaign. And Kerry, you were involved with a little interview that we did here at the office a couple of weeks ago.
Absolutely.
Solid Bite Smiles Back. We're so blessed. To be able to, through our program, where people donate $50 to one of the charities in our charitable giving campaign, or in Solid Bite Smiles Back, I got used to it too. And they just write a check to one of the charities that's listed. And so they bring a blank check and they write a check for $50 or more, and they get the complete examination, including X-ray, CT scan, and everything else, which probably goes for over $600 ordinarily. Just write a check for $50 or more to Helping Seniors of Brevard, and you get it all free. And so, what better way of contributing to your oral health by contributing to one of one of the charities in our campaign, and I have a special feeling for helping seniors at Brevard. I've been involved with it right from its inception. So
Yeah,
ready to check there.
And I know that you've talked about how important it is to you in terms of your dental office to have all the right information about a new patient's situation. And so it really behooves you to have that so you can make the best recommendations as to what course of treatment a patient should have. And yet at the same time, what a great give back that you're making into the community by doing the right thing medically for the person, but also you're also giving back into the community through this program.
Well, thank you, Kerry. It's a special thrill when you reach the milestone, and we've talked about this on the show a couple of times. This year, right at the beginning of COVID, we reached $200,000 in charitable giving. That's a big deal. Our staff is proud of it. Our doctors are proud of it. All of us are proud of it. And patients walk in and they just like the idea. And so I'm glad patients are willing to participate in that, and we're certainly very happy that to help out as well.
Yeah, it's a great opportunity to do a lot of things for yourself. Is give Dr. Sheldon's office a call and ask for that Solid Bite Smiles Back special for new patients, because you're going to be helping the work of helping seniors, and you're going to be making sure that you get a full, comprehensive evaluation of what's going on. So if you are the patient advocate, now is a great time to make that call for the person you're thinking of, even if that patient you're advocating for is yourself. So Dr. Sheldon, how do we reach your office?
Just give us a call, 321-259-8000.
Okay, one more time, so everybody gets a moment, grabs their pencil.
There you go, 321-259-8000.
Great.
Talk with Jill. Jill is just outstanding. What a representative of my office. And Jill is usually the first person to answer the phone. You may be talking to Amy or Kathy, both of whom are very good, but Jill is our primary phone person, and she'll be happy to help you out and get you that appointment.
Yeah, you have such a great and helpful staff in general. In fact, I was thinking we've done someplace along the way, I think you and Joe did a TV show or something about the importance of a good staff. So we learn so much every time together with you, Dr. Lee Sheldon of Solid Bite Dental, and John Harper. I guess as we're getting ready to wrap up on Veterans Day edition of Helping Seniors Radio, any closing thoughts that we should think about?
Well, actually, a real quick question to Lee Sheldon. Lee, when you were in the Army as a dentist, did that provide you some great experience that led to your civilian life as a dentist? What was that experience like?
It actually did. I went there right out of dental school, and then so I spent 3 years in the Army, 1 year at Fort Sill, and then 2 years at the Army War College at Carlisle Barracks. It was a fabulous place because here these were the senior service people, and so it gave me an opportunity to do upper-level dentistry even before I became a specialist. I was living in the same apartment complex with actually on post with senior service people. It gave me a whole level of respect for the military that I might not have had having gone to school having gone to college during the Vietnam era. But yes, I learned an awful lot, and I take some of those skills with me. There was Colonel Ward, a prosthodontist, who taught me so much about removable prosthetics. Here I am, a periodontist, a surgeon, and he taught me so much that I carry with me every single day in this practice.
I was wondering about that. That's good to hear, good to know, Lee Sheldon, and good service to you. Thank you for all of your service in the Army as a dentist, and now, of course, in your private practice for many years here in Brevard County. Kerry?
Thank you, John.
Yeah, and thank you for joining us today for Helping Seniors Radio, and thank you, everybody. I'm surrounded by a great bunch of vets. See you next week.
Thank you, Kerry. And of course, Helping Seniors of Brevard is heard every Wednesday, 12 noon to 1 o'clock, right here on 90.3 FM. Thanks for being with us here, and look forward to having you on the radio with us next Wednesday, Helping Seniors of Brevard, 12 noon to 1 o'clock.